So what is shoulder osteoarthritis? A normal joint surface is essentially covered in smooth white cartilage, and the two surfaces move together with almost no friction at all. In osteoarthritis, the cartilage essentially wears out, and this causes friction, inflammation and pain, a bit like a rusty hinge. As the degeneration advances, you get new bits of bone growing around the side of the joints, body's way of compensating for the arthritis, but this causes swelling and a restriction in range of movement. So what are the symptoms of shoulder osteoarthritis? Well, primarily you're going to feel pain, and that will tend to get worse with more use. It will also get stiff overnight, so it will feel tight first thing in the morning. As the degenerative process advances, you start to lose range of movement, especially overhead, trying to get your arm around onto the base of your back. You also might feel a grinding sensation of the two uneven joint surfaces rubbing together. So what are the causes of shoulder osteoarthritis? Well, osteoarthritis of any joint is essentially a normal aging process which happens to everyone to a greater or lesser extent, and whether you develop symptomatic arthritis is really down to your genetics. Some people have poorer quality cartilage than others, and their joints wear out sooner in life. There is a bit of a myth that arthritis is caused by overuse of the shoulder or using it in a certain way, but actually there's no real evidence to say that is the case. Having said that, if you've had a significant injury to the shoulder in the past, especially a fracture, that can accelerate the arthritic process. So how is shoulder osteoarthritis diagnosed? Well, your doctor will take a history and examine you, and with the support of usually just a simple x-ray, the diagnosis can usually be made. Sometimes the changes are more subtle or milder, and you need an MRI scan or a CT scan to make the diagnosis. All that imaging can be done here at Welbeck. So how is shoulder osteoarthritis treated? Well, there are two forms of treatment for arthritis, either conservative or operative intervention. Conservative therapy takes the form of physiotherapy, oral medication, topical anti-inflammatory gels, but here at Welbeck we also offer injection therapy, and this would usually take the form of corticosteroids, which act as anti-inflammatory, or hyaluronic acid, which is a lubricant and essentially made up of constituents of articular cartilage. If conservative therapy fails, which it does eventually in many cases, then we can go on to do surgery, and that would tend to take the form of a shoulder replacement, very similar to knee and hip replacements, essentially replacing the native joint with a combination of metal and plastic. So is there anything you can do to prevent progression of your shoulder arthritis? Well, essentially, because it is a degenerative condition which will advance over time, to a degree there's only so much you can do, but we do know that remaining active, keeping the shoulder joint moving, having a healthy lifestyle, maintaining an optimal weight, and not overloading the shoulder probably does have a preservative effect. If you would like to find out more about shoulder osteoarthritis, you can find out more information on the Welbeck website, or should you wish to be seen, you can book in to see one of us in the orthopaedic department on the ground floor